two cases. I know Karen has one. Anybody else have cases or questions?
I have a few questions.
Questions, okay. Okay, well, let's start with the introductions. Brief, who you are, where you live, and your relationship with all this information. Okay, Elena.
Good morning, beautiful people. Elena, formerly of Oakland for many years now in Sacramento County, nutrition educator, Bowman College since 2008, 14 years in a local woman-owned independent health food store in the supplement department, and Christina's level 1 coaching certificate in November of last year. Okay.
And now you're in Mark's new
Smashing addiction, the addiction recovery engagement training, which engages families also, and it's just absolutely mind-blowing. I gotta say, it's fantastic.
Yeah, it teaches both family members and practitioners skills in how to, effectively engage people in the recovery journey when they are not wanting to do so.
Yeah,
it's not like intervention. This is a completely different approach too.
It sure is. Yeah, highly recommended.
Well, by the way, Elena, Mark thinks that you're like really gifted, and that once you're ready to build yourself a coaching business, he thinks that you're like going to be, God's gift to Sacramento County.
Oh, cool. Okay.
So you just keep moving along. Okay.
Okay. All right. Thanks.
Yeah. All right. Francis.
Good morning, everybody. I am in San Rafael, California. I am also a Bowman grad, 2006. I got exposed to Julia's work years ago, working with a chiropractor, and been playing with aminos ever since, and learning. Did level 1, now in level 2. Very excited about that. And I work with kids and adults, some in mental health, and the adults are in recovery as well.
Wonderful. Welcome.
Thank you.
Sherry.
Good morning, Sherry here from College Park, Maryland. So happy to be with the community, and I just have a passion for all things represented by this community. Good to see you all. I'm a licensed mental health counselor, holistic health coach, and I completed level 1 a couple of months ago, and look forward to jumping in with level 2 as soon as my schedule allows. I've really been practicing the aminos, particularly in my own life, plus with colleagues, friends, and relatives. So that's the stage I'm at. And that's all I'll say for the moment, but I'm just so happy to connect with all of you.
Welcome, Sherry.
Thanks.
Kimberly.
Hi, I'm Kimberly Donners. I'm a licensed professional counselor in Paonia, Colorado on the Western Slope. And I did Christina's trainings about 10 or 12 years ago. I had some experience with aminos that from things I had learned on my own. And I think I read some of Julia's work back in my 40s and found 5-HTP to be really helpful for me at that time. So I use them both with myself and with my clients. And it's just really added an amazing element of a whole nother level in which, and I treat mostly ADHD, anxiety, and depression.
Good to see you, Kimberly. Welcome.
Thank you.
Karen.
Hi, good morning. I'm Karen. I'm from Santa Monica, California. I am a mental health consultant. I'm a behavioral health strategist. I'm a trained interventionist. I'm a certified recovery coach. I'm a certified nutrition coach. I'm also a certified Chopra health coach. I do treatment placement. I work with treatment teams collaborating as a coach. I also work with a specific treatment center in Austin, Texas for dual diagnosis trauma and chronic pain. I'm trauma trained as well. And I just did the intensive. So I'm kind of new to this amino acid, although I've been kind of following it unbeknownst to me on my own with the supplements that I've been taking and some of the neuroscientists that I follow. But I've been getting a lot of clients newly sober, even though I work with treatment teams and I'm the nutrition piece of it. So I have a new client that I just started with. I just met with her and did the assessment. So I'll have my first real session with her this coming week. And I was talking with Christina about it because it's a little confusing for me because it feels like she could use all of these. And how do you kind of figure out which one to recommend? And so I'm happy to be here.
All right, so glad you're with us. This is where you'll really learn how to apply all the knowledge in a hands-on form. So Kimberly, let's start with you and your cases, and then we'll move on to Karen.
Okay, so I have a new client who has been taking Lunesta as well as an over-the-counter sleeping aid. She doesn't take the over-the-counter stuff every night, but it sounds like she feels like she just cannot sleep without Lunesta. This is a long time thing with her. Before she took Lunesta, she took Ambien for a long time, and she would really like to see if she can't disengage. I think she primarily has anxiety, kind of a generalized anxiety from what I can tell so far. I haven't assessed her yet, but she is open to working with aminos. I just never have worked with weaning someone off of a sleeping pill, and I looked Lunesta up, and it is definitely a serotonin enhancer. So I just wanted some advice on how to approach helping her deal with this.
So same, right? Let's see what her chart looks like, and specifically what her serotonin numbers are, because it could be that the Nesta is helping raise her serotonin activity for more than just sleep. And so you want to take a really close look at whether she needs generalized serotonin support or whether this is just a weaning situation.
So if she still needs generalized serotonin support, that's going to show up in the daytime cravings, all the things.
That's going to show up with higher numbers in the chart, kind of across the board.
Yeah. So what if her numbers are not high? That means the Lunesta is carrying over.
That is probably what that means. Yes. Okay.
Yeah. Right.
And so then what you do is you just, is she willing to work with her doctor on tapering?
I think so.
Of the Lunesta. Okay. So, with any of these medications, we don't recommend that people go any faster than a 10% drop. So have her get on a taper schedule with her doctor, see what the schedule is. If it's faster than 10%, you may want to have a little conversation with her about that. Okay.
It almost always is, according to
it almost always is. And then she just starts tapering. And once those numbers on the chart start rising, or once sleep starts having difficulty, okay, that's when you bring in either 5-HTP or tryptophan. And you're going to have to play with it, because we know that the rule of thumb is when somebody's on some sort of serotonin support that you take the precursor 6 hours away. She may need it closer to bedtime, okay?
Right.
So you start 6 hours away
Yeah.
and you may raise it. And then, you know, if it's just not working well enough, then she gets to bring in a little bit, let's say if she's taking the Nesta at bedtime, then I would bring some in at dinner time. Okay, but that would be your second step, Kimberly. I would start with the 6 hours earlier and just raise her serotonin levels generally and see if that carries over. And then really listen, and we all have to do this, ladies, right? Really listen to what her symptoms are of sleep distress. Because there are many different symptoms of sleep distress. And knowing what they are will help you determine what is the right intervention. Now, have you all seen the sleep survey that Mark and I created?
No.
No.
Okay, I ought to have it. Why don't you guys, hi Valsa, hi Kathy. Let's have, while I'm looking for it, let's have Valsa and Kathy introduce yourselves, and then hopefully I will have found what I'm looking for by then.
Yes, hello everyone. Good morning. Can
Good
you hear me?
morning. How are
Yeah.
you, Kathy?
I'm okay. Yeah, just another interesting day.
Yeah.
Yeah. So
So
let's
just a
see.
little bit about who you are, where you live, and what your interest in this stuff is.
Yes, I am a certified as a holistic health coach. I did a summit for biohacking addiction and mental wellness in June 2022. And I just closed on my home in Illinois and last Friday and or June 20th. And I'm here now in Florida, in Fort Myers, Florida. I'm interested because my son has schizophrenia symptom for 3 years now. He had psychosis, and last night, I think, I'm not 100% sure, he's been on medication, but I think he still might be doing some kind of marijuana because he had really, really bad munchies. Which, I mean, the medications also could bring the munchies, but I'm not sure. I'm just guessing, but I have a hunch. So that's who I am. And thank you, everyone.
Welcome.
Thank you.
Looks like I don't know where I have this sleep. Valsa, why don't you introduce yourself?
Hi. Actually, I'm out for a walk.
Oh,
So
okay.
it's okay. I'm Valsa Madhava. I'm a general internist, addiction medicine specialist, functional medicine, and now cellular medicine. I've gotten into peptide therapy. So looking at
Oh, have you
how to-
really? That's cool.
how to make the cells work better. That's my focus right now. And I treat, I guess, patients with addictions and benzotapering, and actually at the point of willing to take on anyone with like mental health issues. And based in New York.
All right, very good. Did you get that email I just sent you about about what about
Genes.
genes?
Yes, I haven't had a chance to look at it. So once I do, hopefully I'll have some time this weekend. I will reply to you, and let's.
It's pretty comprehensive.
Yeah, let's look at it. Let's see what we can do.
Yeah, I think we'll have fun with it. Okay, I'm sorry, everybody. I cannot find my sleep survey, so I will have it for you all next time. Okay, so anybody else want to jump in with Kimberly's case? Ideas, thoughts, experiences. Anybody have experience supporting somebody coming off the Nesta?
No, not yet.
Okay, well, we'll be interested in hearing how it goes, Kim.
Thank you. Did you want me to talk about my other?
Yes, your next case.
Yeah, okay. So the next one is a client with ADHD, and he has I've been gradually very slowly getting him into nutritional support. So far he's taking fish oil and a good multivitamin. In the meantime, he's got really bad acid reflux, and he takes I think it's omeprazole.
Mhm.
I'm not sure exactly how it's pronounced. So I was trying to encourage him to get off of that and start working on his gut. And he tried going off of it for a little while. No, okay, yeah, that's what his doctor said too. So
And I'll explain why in a minute.
yeah. Well, she's worried about his esophagus. He has had 2 endoscopies, and there's no indication of esophageal cancer at all at this point. But she told him, to look at your diet and work with a nutritionist, but don't go off of it. I'm like, okay. So anyway, what I've got him started with is taking a probiotic in the morning, because I've been doing that and I have not been having any acid reflux, which is huge,
Right.
since I was really struggling with it myself. And I also have a heart condition, and I wanted to be able to distinguish between heartburn and real heart pain. So I've got him doing that. He's going to start doing super enzymes. He's reduced his coffee intake quite a
By the
bit.
way, I just want to point out, is this the super enzymes by now?
Yeah.
Okay, so that has 200 milligrams of hydrochloric acid per capsule. And so
Mhm.
Francis is actually going to be educating us all as to why that matters in just a few minutes. Aren't you?
Oh, good.
Francis?
Yes, coach.
So yeah, so that, and I'm trying to get him to reduce his carbonated beverages. Other than that, I've been thinking about recommending aloe if his stomach stuff continues. Any other thoughts? Is there ever a point at which he can get off of that medication safely?
Absolutely, there is.
Mhm.
But you have to do it by addressing the underlying root cause.
Yeah.
And so we're all going to be really supportive of Frances as she tries to put into words what she just learned in the level 2 training.
There's many reasons why we have acid reflux. We
Mhm.
need to get to the root cause. The omeprazole, or whatever, however you say those PPIs, are shutting down acid production,
Right.
which is not allowing us to break down our proteins into amino acids. And then from there, they can't get into the neurotransmitters. So we have to back it up. We need to chew our food more. There's enzymes in the saliva to help you start to break down the carbohydrates in your mouth, but it also coats the food and allows it to slide down the esophagus very gently. So you have to chew your food more, eat in a less stressful place. You really need to look into food sensitivities. And I was just reading one of my study books for level 2. Gluten is a huge problem with this. Okay. And unfortunately, we love it. We eat it all the time. But we need to have enough of stomach acid in the stomach in order to keep that lower esophageal shut. And if there's not enough of stomach acid in there, that won't stay shut. And the one at the bottom, the pyloric sphincter, it can't open. And now you have putrefaction and fermentation, bubbling and everything else, causing that burping, gassing, opening up that lower esophageal sphincter. Okay, and if the food is not acidic enough when it lands in the small intestine, that first part, which I always call the duodenum, or people could call it the duodenum, it isn't going to stimulate the production of the amylase and protease and the bile to come out and help absorb those, to break down those nutrients further and absorb them. So there is where this long program, this long cascade of events happens. So we have to back it up and support them with increasing the hydrochloric acid and helping them bring that up to a better level where they can then begin to titrate off of that PPI. And in the meantime, you can do mastic gum can help with that.
Oh,
Aloe, as you mentioned, can be very helpful with that. And glutamine is another good one because it
Oh.
helps to heal the gut lining and that stomach lining as well. But that can be very helpful. And then we need to take them off of things that can be very problematic, which is the coffee, eating on the go, eating lots of different foods, not chewing them up.
And he mentioned overeating.
Oh, yes.
He's from a family where culturally mom gets very hurt if one does not stuff oneself. And so he has become aware of that and is trying to only eat till he truly feels full and not over.
So
Very
how
good.
old is he?
Hey, Francis, I'm going to jump in here for a second.
Please.
Good job, by the way.
Thank you.
Yeah.
Yes, thank you.
So just so that all of you understand why I put Francis on the spot is because the very first lecture in level 2 is the first third of it is about stomach acid and acid reflux. And because it is such a major issue in our society, what most people don't understand is that severe acid reflux most of the time is due to not enough stomach acid production at the time of the meal, leading to for a variety of reasons, leading to what acid is there coming up either at the time or several hours later in the form of acid reflux. So the very first step in addressing this, in order that people can successfully come off their medication, is to improve their hydrochloric acid production or presence. So the things that improve its production is chewing and eating in a more relaxed environment, because stress cortisol levels will decrease stomach acid production. Now, overeating, of course, your body just can't keep up with it.
Mhm.
So I'm glad that he's working with that. The next step, so the mastic gum and the soothers that Francis was talking about, those are really good if you have inflammation in the esophagus or the stomach or the duodenum. They're not good in and of themselves in increasing hydrochloric acid production or stopping heartburn. So this is where you're already bringing in one of the steps, which is using the super enzymes by now, because they're a full spectrum enzyme formula, which means they have hydrochloric acid and bile. Mute yourself, somebody, please.
I think it's Jeff.
Oh.
That, and as far
and it has 200 milligrams of hydrochloric acid, which is a really nice beginning dose.
Mhm.
Okay, but it may not be enough, and especially not with the larger meals. So with his larger meals, or if he feels like he overate, then he should take 2 or 3 of them. Okay, somewhere kind of not right at the absolute beginning of the meal, but maybe a third of the way through. Now, he can also add a tablespoon of vinegar diluted in water. Apple cider vinegar tastes better than your straight white vinegar, because that will improve the acidity of the stomach and also reduce this rebound heartburn.
Would you do that with a meal?
It would be at the end of the meal.
Ah,
Okay. Now, given that you're using the now enzymes, he may not need that,
yeah,
but it's not a bad idea anyway. So once you have that in place, and he finds that the sort of breakthrough acid reflux gets better and he just starts feeling better, that's the time
mhm,
to start pulling down on the PPI and allow the body itself then to start producing whatever it's going to produce of its own. But you're definitely going to keep the digestive enzymes in there and the vinegar if needed. Okay, and if he needs extra hydrochloric acid, like he comes off the PPI, but the stomach is not stepping up its own HCl production, and it takes some time for the body to sort of, regroup itself. I mean, once the stomach's doing its own, then you can start pulling back on the other things, but that's not going to happen for a while.
yeah,
Okay, so this is replacement hydrochloric acid.
exactly, yeah. And I also have him trying to eat he's been eating his heaviest meal at dinner time. And I know for me, that just doesn't work.
No,
No.
For some people it does, for some people it doesn't. But once you bring in the hydrochloric acid, it's going to make it
helps.
easier. Yeah.
It helps. I also have him trying to sleep on a slant. I don't know if you all know about that, but that one can help because his heartburn is generally at night.
Right. And that's when most people's is.
Yeah. I was
How old
getting
is
it
he?
all day long. Oh, he's in his 30s.
and lastly, quick question. How old is that last client with the sleep issue?
She's also in her early 30s.
Okay, thank you.
Sherry, the question about bloat is whether the bloat is right at the time of the meal, 2 hours after the meal, all day long, because extreme bloat can be due to a very wide number of factors.
I see.
And lack of hydrochloric acid is certainly one of them, but not the only one.
Okay,
This is where you have to put on your detective hat and go
right.
through all of the different possibilities.
So this person is mentioning it very shortly after the meal, but is also problem-solving depression and anxiety. And I'm not to veer off course too much, but I'm wondering how much those mental health symptoms might be related to the gut function.
Absolutely and directly. So bloat at the time of the meal or directly after is definitely a sign of lack of hydrochloric production. If you are not, if you don't have enough HCl, you are not breaking down your protein effectively, which means you're not liberating the amino acids to keep your neurotransmitters nice and happy. This is why digestion matters to mental health. One of the many ways in which there's several ways, but that's one of them. Elena, you were going to say something.
I was just going to mention a pretty very cool HCl product by Enzymatica, and it has in it, so they're saying what's in 2 capsules. 1 capsule of the betaine HCl is 650 milligrams. Then it also has their acid active protease blend,
Right.
and their trademarked what is called Mucosave FG. It's a pretty cool product.
So they're protecting this. They've got stuff in there to help support the mucus production of the stomach from the acid. Want to let everybody know that for some people, the 650 or whatever milligrams of HCl is exactly what they need, and maybe they need 2 or 3 of those. For other people, it's too much. And
Right.
if it's too much, if you get a warmth or burning in your tummy. So there is also an HCl product that has 240 milligrams of HCl in it.
Mhm.
And so we often recommend that you start there and kind of build slowly. And so the now enzymes that Kim recommended has 200 milligrams of HCl. So that's where you get to start slow and then build.
Mhm. Yeah, for me, even that one, if I don't time it right, can burn.
Yeah.
Solar Ray makes a good one too, with I think 250,
Yeah.
and it also has the pepsin,
Yep.
and it's a capsule, not a
Yeah.
tablet.
This can be tricky. Some people, we can fix this really quickly. Other
Yeah.
people, and Kimberly, you're kind of one of those people, it's a dance. And a lot of things impact it, and you just have to be kind of slow and gentle and loving with your
Yeah.
digestive tract.
You know, another thing I've been doing, because at one point, Christina and I were suspecting I might even have some kind of bacterial thing or some bug in my tummy too. So I also take an olive leaf capsule, olive leaf extract.
Mhm.
I take those for a week, and then I do a week of oregano oil.
Nice.
Mhm.
And I don't know, maybe I don't need it, maybe I do. But all I can tell you is I'm feeling a lot better since I've added that element too.
Well, good, because those are both antibacterial. So if you have any degree of SIBO, small intestine bacterial overgrowth,
Oh, yeah.
that takes care of that. If you have overgrowth of yeast or bacteria lower down, that, should take care of that as well.
Yeah,
So you're covering a bunch of bases with them. So I would keep going.
exactly.
And then the probiotic is making sure you're keeping the good guys nice and happy as well.
Yes,
Well, good for you.
thank you. I'm very pleased.
All right. Want to jump into Karen's case in a minute, but Francis, you said you had some questions.
I did. I have a very dear friend who I'm using as a case study. And she is 67, I think, 66, 67, suffering from terrible insomnia. She is a cancer survivor of 2 cancers. And I think there's a lot of grief in here. I think there's a lot of anxiety in here. But about 1.5 years, she just started having this issue with sleeping. She's very well versed in gluten-free and all her balancing of her blood sugars and lots of things. And she hates she's taking a little bit of Ambien when she needs to, because her insomnia is so bad that she will take it on the nights that she has to work, but she doesn't like having that hangover from that. So I was, trying to get her to do some tryptophan, 5-HTP, see what works best for her. When she takes melatonin, it causes major bad dreams. She will not touch it. She gives insomnia at 10 on the amino acid chart. She's got depression, winter blues, and worry at 8s, and irritability and anger at 8s, and afternoon cravings at 8s, which could be, she says, that's because I'm tired. Now then her
Yeah,
GABA,
but
this is what she's saying to me.
no,
You know, and
I
it's-
understand that, but I think that's a really clear sign that
Right.
serotonin needs supporting in
Yes.
general, not
Yes.
just melatonin.
No.
Serotonin. Yeah.
Right. And she doesn't do well on the melatonin, so she
Right.
won't touch it. Okay. And her catecholamines are all at a 10.
That's because she's tired.
Yes. And then let's see, her GABA, stressed, burned out, unable to relax, those are an 8 and a 9, often feel overwhelmed, crave food, those are at a 5. So
Okay.
she would do well to take a little GABA.
She sure
And
would.
I told her to start taking she tried Seraphoss, that didn't seem to work. She's working with a naturopathic physician.
That's not the issue.
No.
This is not a high cortisol issue. This is very much a low serotonin, low GABA issue.
Yeah. So I
And low
told her,
dopamine too, right?
well, that's because she's tired.
It may be, Kim, but you've got to be careful. I mean, when you look at catecholamine numbers, the very first question you have to ask is, are you getting enough sleep?
Right.
Because fatigue, not enough sleep simply is going to, it's not even so much low cats, it's just you're tired.
Yeah.
Now, raising
she's
your
extremely
cats
tired.
will help you cope with that, but that's not the underlying cause.
Gotcha.
Yeah.
So would that be detrimental to as you're trying to get the serotonin up to help her with a little bit of stimulation in the morning? And then because she's a cancer survivor twice,
Yeah.
she's got to do the Mucuna purines, correct? No,
What type of cancer does she have?
she had breast cancer and she had throat cancer.
Yeah, so neither one of those are melanomas.
Okay, so she can do the tyrosine.
She can do the tyrosine. Yeah,
Perfect.
that's fine. And the cancer is not present currently, we hope. In this.
No.
Yeah, so yeah, you don't have a problem there. So yes, I would just do, a regular interpretation of the chart. And I would definitely be supporting her, like do either TRIP or 5-HTP, whichever works best for her, significantly before bed, but also during the day.
Yeah.
She's got those other high numbers. And, a lot of people really like that theanine serene because it has both GABA and theanine in it. And it's two tablets before bed, but she can also take one during the day at the times that she feels the most anxious.
Okay.
Or even half of one. So she can play
Yeah.
with it.
Okay. I like that. So,
Yeah.
and I said, get up to at least 2,000 of the tryptophan at bedtime. Take it before. You're not
Yeah.
going to fall asleep. It's just going to support you so that by the time you do go to sleep, it's going to work for you.
Yeah, well, I mean,
Yeah.
I would do some 5-HTP during the day,
Yeah.
as well as the trip, at bedtime.
Yeah. Okay. And, since she is so tired and wanting to sleep, would you start somebody at like 1,500 or 2,000 of the tryptophan at bedtime? Or would that be too much and start at like 1,000 and then see
I
how
would
it
start
goes?
at 1,000. I would start at
Okay.
1,000 with some of the theanine serene,
Okay.
and then see what that does. And
then
then, then you can build both of those, because again, you're wanting to avoid grogginess the next morning.
Right.
So, you start low and then you build.
Right. Perfect.
And you'll know, I mean, she can trial herself the first night, Francis. Okay. Because if she takes 1,000 milligrams tryptophan and one of the theanine serene, and she's still awake half an hour later, she takes another theanine serene and another one pill of the tryptophan and see what happens. And then at the first night, I wouldn't go above the 2 pills of the theanine serene and the 2,000 milligrams of tryptophan. I mean, whatever happens that night is what happens. But now you have good information the next morning. You make sure that she's eating within 3 hours of bedtime, so low blood sugar is not an issue. Right? You just make sure you've got all those bases covered. But this is clearly low GABA and low serotonin.
Okay. Thank you.
All right. Okay, Karen, your client.
Thank you. Okay, like I said, I just met with her, so most of the session was getting complete history. And I didn't get into giving the amino acid assessment. She's 33, female, 33, chronic relapser, has a lot of unresolved trauma. I'm part of a treatment team, so she does have the right treatment team around her to deal with that. I'm just focusing on the nutrition piece, but her father was in 22 rehabs and then ultimately died of alcoholism. Her stepmom jumped out of a window 4 months later and killed herself. And her younger brother was diagnosed with schizophrenia. So she has also an older brother. Most of her life has been verbal and physical abuse from her brothers. Her way of dealing with it is bullying herself. She does not know how to stand up for herself. What she claims, and I have not received her blood work yet, is that she has low iron, she has hypothyroid and was on medication. She couldn't remember the name of it, is no longer on it. She said she gets acid reflux, but she drinks 5 cups of coffee a day on an empty stomach, drinks 1 bottle of water a day at the most, claims she is sensitive to shellfish, very sensitive to sodium, sugar cravings, sugar addiction. She smokes a pack of cigarettes a day. She says she has bad reactions to soy. She's addicted to cheese. She is currently on taking vitamin C and vitamin D. She also is taking trazodone for sleep. She says she has anxiety and can't sleep. She was on Vyvanse for a year and now is down to 10 milligrams every other day. She also just ended a very toxic relationship. She claims the relationship ended 3 months ago and that he claims it ended a year ago. So when she gets triggered and has cravings, she will either binge on sugar or she has love addiction and will text him 20 times or will walk by his house and stalk him. So I wanted to recommend, and again, this is without having done the assessment, but I'd love any input. I wanted to recommend glutamine in the morning. I also wanted to, and I have her on certain foods, which we are going to start with next week. I'm going to go grocery shopping with her. But I also wanted to recommend
What are the foods, Karen, what are the foods that you have her on or that you recommended she try this week?
Her blood type is A positive.
Okay.
She agrees, she doesn't like, she doesn't want to have any meat, but she claims she has low iron. So I'm waiting to get the blood work before I recommend any of that. I said, I mean, it's pretty much the SIBO diet, which is what I'm following. And it's pretty basic at first, and she was agreeable to that. I'm actually going to cook with her so that she has food for the week. That actually came up. That's what Christina said to me yesterday, which I need a little more education on. So I'm so excited to have everybody's input.
Let's stop just for a moment, Karen.
Okay.
A lot of information.
Okay.
And this really is a learning opportunity for everybody. Francis, what was it? What was the clue that this woman is probably pyroluria?
Just doesn't have an appetite for meat.
That's one of them. What's the other?
The
Anybody?
low iron.
The low iron, exactly. Okay. Pyroluria is an issue with hemoglobin metabolism. And if you look at the pyroluric questionnaire, anemia can be one of the symptoms. So we have problems throughout her extended family, anxiety. We don't know if she has anxiety from kindergarten, but she probably does. But a lot of anxiety. She's a chronic relapser. She doesn't like meat. She doesn't like eating in the morning. She probably wraps her life around one person. We don't know much about this toxic relationship. So there's enough symptoms right here to immediately do the pyroluria questionnaire, and if possible, do some laboratory testing. The reason why with this client it's important to start there is because otherwise you would start with 5-HTP and tryptophan, but without the cofactors in place, they're not going to work. It's more likely to get an adverse reaction to 5-HTP if you have pyroluria. and are lacking the cofactors. So with this person, it's really important to start there. Now you can trial her on 5-HTP and see if it works or if she has an adverse, but know that, yeah, there's so many signs of pyroluria here that if the 5-HTP does not work, it does not mean that she doesn't need it. It just means that she doesn't have the cofactors to do the conversion. Now, thank you. That also means that she doesn't have the cofactors to do the conversion into GABA, because to convert glutamate into GABA, you need both B6 and zinc, which are the two cofactors impacted by pyroluria. Yes, you see, no social life and prefers to stay home is definitely a marker of
Big time.
pyroluria.
I was just about to ask about the isolation.
Yeah.
Yeah.
So you can bring in GABA. I would start with a GABA formula that has inositol in it. So True Calm by Now has inositol. I can't remember if theanine serine, which we've talked about, but because inositol is very useful for people with pyroluria, so is niacinamide. And niacinamide, by the way, is extremely useful for people with alcohol use disorder and for people with schizophrenia. So the schizophrenia is running in the family. So doing 500 milligrams of, or even starting with 100 milligrams of niacinamide, but 500 milligrams a couple of times a day. And Kathy Mendez knows something about using niacin, could be very calming for her, and a place to start in lowering the cravings and giving her some balance while you're testing the pyroluria. But this person's also going to start feeling better immediately once you get protein in every, 3 to 4 hours, get that blood sugar stable. And of course, the glutamine will help with that as well. And get the water in there. She's going to start feeling better immediately.
So the GABA and inositol, how much should I recommend? Oh, the now chewable GABA. Okay.
Yeah, so it depends whether she prefers chewing it or swallowing it.
I think swallowing it.
Okay, then I would get either the theanine serine that we already talked about, which is a very powerful formula, or True Calm by Now, which is a mid-range formula.
Okay. And then
Sorry, theanine serine does not contain inositol.
Then I would do True Calm.
Okay.
I would go with the True Calm formula, and I would use several of them throughout the day as she needs them.
Okay.
Like whenever she feels like her anxiety is going above a 5, bring that in.
Okay.
And she's, other than the trazodone for bed, she's not on an SSRI, right?
No.
So you know what you could do, and I haven't done this with pyroluria, but it just occurred to me, is while you're doing the testing and getting the cofactor situation straightened out, you might want to try St. John's wort.
Oh, okay.
Okay, earlier in the day. Maybe, in the morning and midday, not with the trazodone, because St. John's wort doesn't require the cofactors of zinc and B6.
Okay.
Okay. I've heard it described as either an MAO inhibitor or similar to an SSRI. I'm not quite sure which is the most accurate, but that's how it impacts the serotonin system, is by impacting the breakdown of either the transport, the recycling enzyme or the breaking down enzyme. Either way, you end up with more serotonin in the synapse, which is what you want. So while you're figuring out the pyroluria, I would bring in St. John's wort because she really significantly needs serotonin support.
Okay.
Okay.
So St. John's wort, the GABA-inositol by now, and the niacinamide 500 milligrams.
Yep, maybe 3 times a day.
Is there any brand with the niacinamide?
No.
Okay.
And again, we prefer capsules to tablets, that sort of thing.
Okay.
Christina, is there a difference between niacinamide and nicotinic acid for this patient? Or do you always use
She's got so much going on that I don't want to have to deal with the histamine flush. And so niacinamide is going to release less histamine than the nicotinic acid.
and it's just as effective?
And just as
Because
effective.
I've heard that you need to have the flushing to get the effects, especially like for psychosis. I don't know, but I'm just asking.
You don't need the flushing to get the effect, but like Lotus suggests using the flush form with psychosis to physically ground people and bring them back into their bodies. And so that can be useful, but no, it does seem to work anyway, at least according to Hoffer. So Dr. Abram Hoffer, way back when, wrote a book on alcoholism using nutrient therapy with alcohol use disorder. And most of the book is talking about niacin therapy. So does that help, Karen? Does give you a little bit of direction about where to start?
Yes, that helped tremendously. Thank you.
Great.
Thank
You
you
can do this. And what you're looking for when you trial when you have them, trial the aminos is, aminos are supposed to start working within 20 minutes.
Oh,
St.
okay.
John's wort works very quickly. So this is why we can trial them in our office, give them a particular dose of something, wait 20 minutes and see what's changed. Have them rate themselves on a scale of 0 to 10, like for 3 specific symptoms that they're experiencing. Give them the amino acid. And then 20 minutes later, ask about the same 3 symptoms and see where they are on the scale. If they've come down, great, it's working. If they haven't, give them a second dose.
Okay.
Francis, your hand's up.
Yes. With someone like this, would you recommend taking like something like total amino solutions to help with the foundational piece of getting those aminos in because they don't want to eat the protein? How do you feel about that? Is that too much?
That's not too much. So that is absolutely something to do. But let's see if she can just fix the food piece first. If you find that getting that protein in throughout the day is not going to happen in a reasonable manner, then you're going to have to supplement with an amino acid formula.
It's not that she doesn't want to eat protein. She'll eat protein. She just doesn't want to eat soy or beef.
And that's fine. But what we're wanting her to do is eat the protein 4 times a day.
I said I want her to eat every few hours.
Yeah. And so that's what I mean. If she's not willing to do that, look, it's hard to get 80 grams protein in 1 meal.
Yeah.
Is she hungry in the morning, Karen?
She's not hungry in the morning and she likes the feeling of having coffee on an empty stomach, even though it burns her throat. And she will have 5 or 6 cups of coffee with cigarettes.
So this is where you do bring in the tyrosine.
Okay.
Okay. Because the tyrosine will give her that little bit of edge. And you see, I think this is why she's on the Vyvanse too. Because the Vyvanse is a stimulant medication. The coffee is a stimulant medication.
Mhm.
She is currently addicted to stimulant meds. Okay. I'm gonna come straight out and say it. Even though she's pulling back on the Vyvanse, I wonder if her coffee intake has not increased. Would be a good question to see if her coffee intake has increased since she started pulling back on the Vyvanse. Because they hit the same part of the brain.
Okay.
Okay, she likes that jittery feeling. So that tells me that she's pretty low catecholamines. Now, she's alcohol use disorder. Any other drugs along the way?
No,
Just alcohol. And what does the alcohol do for her?
numbs her.
It
just,
numbs her.
yeah.
Okay, ladies, what comes to mind?
DPA.
And gentlemen, hi, Jeff.
Endorphins,
Endorphins.
DPA.
The
Yep.
DPA.
She might do well on the, hold on, what am I thinking? The DLPA.
She might do well in the DLPA with some extra tyrosine.
But
So-
Karen, you really need to have her fill out that amino acid form. That'll make it so much easier for you.
Okay, thank you.
Yeah,
Yeah.
absolutely.
And you had said at the beginning, like, it sounds like she needs everything. She very likely does.
Well,
Correct.
if I recommend all of these, how am I gonna know which one is working and which one is she's having a reaction to?
Who's going to answer that?
I was just
would
about to say,
start-
take it away, Christina. You're gonna ask her which area of that form, if you had a magic wand, you could fix, would she want fixed? And go
Okay.
from there.
And I would start with Christina's suggestions. And, well, you got to get her tested for pylori, of course. And then, like Christina said, see if she tolerates 5-HTP or try the St. John's wort. Yeah, I mean, I usually give people stuff one at a time.
And I don't.
Yeah, so it depends. It really
Okay.
depends. If they're super
Sure, so good.
depleted.
So here's, and you're absolutely right. So starting one at a time will allow that particular neurotransmitter system to reduce and those particular symptoms to improve. So when somebody needs help all the time across the system, the way this woman does, she has what I call a starving brain. Okay. She is brain malnourished. All of her neurotransmitter systems are struggling and probably has been since she was a little girl. You then add trauma to that, and trauma significantly reduces our neurotransmitter systems and our nutrient level by using it up in great big gobs. Okay. She's got, if she's living in PTSD, she's got sympathetic arousal anyway. And this is where you see in the pyroluria recommendations that this is where you want to bring in, vitamin C and pantothenic acid and blah, blah, blah to support the adrenals. But we're not going to do that right away with this person because too much too soon. Okay, we're going to do step by step. But Karen, the answer to your question is if you address all the neurotransmitter systems all at once, how do you know what's working? Is you go back to the chart because it's not all glommed together. The DLPA and the tyrosine are going to lower the numbers in the catecholamine and the endorphin section. The GABA, niacinamide, etc., is going to lower the numbers in the GABA section.
Okay.
So the chart is going to do the sorting out for you.
Okay.
Okay. It's not that one of these amino acids is going to impact all your neurotransmitter systems. And because they're not, there's just going to impact their own little lane. And so you do the chart every week and it's like, okay, these numbers are going down, but these numbers aren't. All right. So we don't have to change anything over here. but we need to fix something, continue to fix something over there.
And don't they do, the main neurotransmitters, serotonin, dopamine, do need to be in balance to a certain degree, right?
Right.
I mean, if you over support one, you could wind up with other issues from the other becoming imbalanced.
Yes, but at this point, you don't have to worry about that because they're all
Yeah,
balanced right now.
Yeah.
Yeah, they're all starving.
Those are things you fine tune as you go along.
Exactly. And that fine tuning may be 6 months from now.
Right.
Kathy, you have your hand up.
Yes, I was just going to type in the chat. According to Dr. Mensah and Dr. Walsh, they said that if one is undermethylated, one shouldn't use niacin or niacinamide. And if they're overmethylated, then it is good to go. Because according to their research, when Dr. Hoffer was doing his research and all his clinical, patients, but back then, most people are overmethylated, and so that's why niacin works so well. And nowadays, they said in their research, most people, a lot of people, not most, but a lot of people are undermethylated, and they can't, they shouldn't be using niacin or niacinamide. I don't know how valid that is, but that's what I remember hearing from them. And also the folate.
And what I like doing is trialing it and see what happens. Because
Yeah.
either the niacin is going to work and it's going to work quickly, or it's not.
Takes a few months, like for my son. I did the test with Dr. Mensah, and I didn't realize that I had to do the test with the doctor's data. And so the test came back and it said he was overmethylated and it was incorrect. And when I did the doctor's data, they said, oh my gosh, stop all folate, stop all niacinamide right away. And they said it takes a few months to really know, because it would seem like it's working at first, but then like after a while, it actually will backfire.
Mm-hmm. Yes, right now we want to see if it helps. Right now, yes, that is a very sophisticated approach that I don't think we need to get that sophisticated at this point in time. We may down the road, but while you are working on the pyroluria, niacin, when it works beautifully. Now, the lab test you're probably going to do and want to do for the pyroluria is called the Basic Metabolic Panel by dhalab.com. It includes a whole blood histamine. And so the results of that whole blood histamine, when it comes back, will give you an indication as to whether he is over or under methylating. And then we can pursue that. So that's why I like people doing that full metabolic panel, because you get the cryptopyrroles, which is a urine test. You get zinc and copper. We always want to know what zinc and copper is before we start supporting zinc. And it tells you what the histamine status is. The histamine status indicates the methylation status. I know this is a ton of information we just threw at you, Karen. Are you doing okay with it?
I'm okay. I'm trying to find the pyroluria questionnaire.
I emailed it to you last night.
I didn't see the questionnaire. I saw that. I'm looking for it again in your email. I just got the consultation group from you last night.
Okay, well, I will email it to you again then.
Thank you.
Mm-hmm. Let me do that right now. But I did send it.
She's in good hands with you at the helm, Karen.
Thank you. Thank you. This was so helpful. And yes, it was a lot of information. Some good to know that it's things that I've been thinking of, because there were so many aminos to choose from that I thought she would be appropriate for, but obviously I haven't done the chart yet. So this is very, very
Oh,
helpful.
yes.
Thank you
She
so
is
much.
going to be appropriate, by the way. She's going to respond well to all of them once
Okay.
the cofactors are in place.
And here's the other thing that I'm just laughing about myself right now, going, oh yeah, that's right. If you ever want to give them all of the amino acids, have them eat a burger, have them eat some fish, have them eat some egg. They're getting all the amino acids and the protein. So we
You know,
shouldn't
what's
be,
funny is she doesn't, I'm realizing when I said she does eat protein, now she also told me she doesn't like to eat eggs. She
Oh.
used to, but she doesn't want to eat them anymore. She's really limited to what the proteins are. She's fine to eat legumes, lentils, because I had to go through a whole list of like,
Yeah.
what would,
See,
and
but
she'll eat
this woman needs 60
needs
to 80
make-
grams a day, every single day. And once you really look at what she's eating, I doubt that she's getting more than 30 to 40 grams of protein a day.
and being a picky eater is another signal of what? Pyroluria.
Yeah. Does she, do you recommend ever any protein powders?
Of course.
Yes.
Yeah.
What kind? She literally, I opened up her cupboard. She had about 15 different jugs of protein powders, most unopened.
Oh,
She had so many supplements that she said Instagram makes her buy. And she's like, she'll buy all that.
Okay.
And they're unopened.
That's right. So there's very disordered eating here to the point that she may actually have an eating disorder.
Mhm.
So you're going to have to be very kind of gentle and delicate while firm with her.
Yeah.
And it doesn't matter which of those protein powders she uses, although let's try to avoid the one that has, food coloring and junk in it.
Yep. I told her that. Yeah.
But other than that, it doesn't matter which. What matters is that she actually has a cup of that by 10 o'clock in the morning.
Okay.
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 That she has some by 10 o'clock in the morning. So yes, she's going to need a lot of hand holding, and you're definitely going to be working with the entire team here, because this is a very,
Cute.
this woman has a lot of issues going on from a lot of different places, and
Yeah.
she's just going to need a lot of love
Yeah.
from a lot of places.
does she work?
So she is a clinical counselor.
Wow.
She has 2,500 hours. She paused, she failed her ethics exam. She's doing nothing right now. I mean, she literally has, so I'm part of a treatment team where we go in the home. So she has 8 people with her. She has 2 companions that come in because otherwise she'd never leave the house, and they take her out on activities and walks. She, I'm almost thinking she's borderline by proxy. So again, I've had 1 session with her, so it's interesting.
Right.
She does have a problematic relationship with food and mild body issues. She's not overweight. So she's gonna continue to study and move forward in getting her hours. She's very savvy and very smart.
Yeah.
I would have her read. I would have her, and I do this with most of my clients, Karen, is when I think they have pyroluria, especially the savvy smart ones, I have them read Trudy's website. I have them go on some of these other chat groups. I have them do the research themselves, because I want them to diagnose themselves. I
Okay.
want them to say, oh my God, that's me.
Yeah.
Because what that does is it's so validating. It is so
Mhm.
incredibly validating. Once you read, Trudy's biography and how getting her pyroluria diagnosis and effective treatment just turned her life right way up. It's just, now, Francis, did you know Trudy when she was working for Julia?
Yes, I remember the day she came in for the interview. We were all working together. That's where I met Trudy. And it was It's amazing. And, you know, I still do her amino acid class, but she is incredible. And it launched her once we figured out. And that's when I figured out I was pyroloric, was being in that room. And they said to me, if you weren't a nutritionist, Francis, you'd really be a basket case. And I said, I'm pretty much a basket case anyway, you know, but yes. And Trudy's gone light years to really figure all of this out. And her website is a wealth of information.
Yeah.
I have one quick question to help me clarify. What is borderline by proxy, Karen?
Meaning everyone in her family's borderline, or her brother who's schizoaffective. So she has borderline tendencies.
And that would be borderline towards the schizophrenia? Or
No,
towards
no. Yeah. So so she has those tendencies, but that's what she grew up with. And I think that's
Right.
her conditioning of all she knows.
Is
so-
there a family history of trauma related to that?
Oh, yeah, there's very significant trauma here.
Yeah,
So for
yeah.
those of you who don't know, or when we have significant young childhood trauma,
Mhm.
it's like when a sapling in the forest gets knocked down but not killed, and like something's like there's a tree over it, and so it grows along the ground for a while and then it finds a way to grow straight, but this tree is sort of deformed from the beginning because it has this thing sitting on it and has to figure out how to grow around it. And so early childhood trauma, depending upon what time, you know, when in this, like the first 5 years it occurs, is like something sitting on this baby tree, deforming it, that it has to grow around.
Wow.
Well, these deformations can have very similar symptoms. And over the years, these symptom categories have been given names, and they're called personality disorders. There's other ways of thinking about this, but one way of thinking about all of this is the personality disorder way, which can be useful if you, just as long as you don't define the person by their personality disorder. Borderline personality disorder is one of the disorders, and it's characterized by a number of more kind of, well, a number of symptoms. I'm not going to go into what they are. I have but because of all of the trauma she experienced, and the fact that, you know, her parents probably themselves have personality disorders, otherwise known as attachment disorders.
Yeah.
So there is attachment wounding. Her attachment is not going to be good and solid and secure, which is part of the setup for what we call personality disorders. I have an article, Karen, on using amino acid therapy with people with borderline personality disorder.
Oh,
Okay, so I'll send it your way.
thank you.
Can you put
Yes.
that in the chat by any chance?
Sure, how will I do it?
Or do we just email you and you can send it out to us if we
Well,
email you?
It's floating around. It's definitely floating around my articles. I just don't know where it can be most easily accessible. I'll talk to MJ about it, but you know, it's probably in the blog section of the Academy somewhere. And if you can't find it, ask MJ, and I'll make sure she that's located it.
And it's an article on borderline, using amino acids with
Yeah, with borderline
personality.
personality disorder.
Christina, where is your blog?
It's on my website on the front page of the aminoacidtherapy.com.
Are these recordings there also? Where are these recordings?
These recordings are on YouTube and in the closed Facebook group.
Okay, great. Thank you.
Jeff, I didn't have a chance to ask you the you or Valsa. Do you have any cases that you want to run past us?
I do not
Okay,
No, no, Christine, not this time. Maybe next
okay,
time.
cool. Just want to make sure that you're not getting ignored.
Thank
Yeah,
you.
I think sleep is always an issue. So that would be great as we, as you talk about sleep, maybe when you have the questionnaire, we
Mhm.
can talk about sleep. I think that's, it's a never, for me at least, it's a never resolving issue.
There is a recording we did in the community forum focus on sleep from October. October? Yeah, October. Because I was at Mindshare.
And that's in your, the Facebook group, the close
That's in
Facebook
the
group?
Facebook group from October, and it should also be in YouTube.
Okay,
Yeah.
thank you.
Yeah, but I'll be happy to talk about sleep again. I mean, yes, we always need to be talking about sleep. Okay, anything else? Questions, comments, stories?
What is the Facebook group?
So you would have been sent a link to it, and you can reach out to MJ and she'll send you another link
Okay,
to be invited to our closed student and alumni Facebook group. There's about 150
Okay.
people in it, and it's pretty active.
And the
Okay.
name of that group is the alumni group?
Yes, students.
Mino Academy alumni?
Yeah. Academy for Addiction and Mental Health Nutrition. I think it's a student and alumni Facebook group. It's a closed group. You have to invite
I have a-
yourself to it, and then we'll let you in.
I have a question. Can you trial, I heard you say you can trial both niacinamide or niacin and St. John's wort. You can trial it like we do the amino
Yeah.
acids.
Yeah.
And
I mean,
what
you're
are the
gonna have a niacin, you know, if you can get a niacin flush within like 20 minutes of taking niacin. So, you know, you also get a calming effect pretty quickly from it as well. And you can turn off psychotic episodes with it when it's working within 20 minutes as well. So yes,
So
you try it like immunodes.
So you would do like 500 milligrams of either niacin or niacinamide
You
and
keep
someone,
raising it. Yeah.
and every 20 minutes, like you do with the amino acids.
Mhm.
And which brand of St. John's wort do you like? And what's the dose? Is it 200 milligrams?
No, oh God.
Is it the Jarrow brand?
I am not, it was too long ago. I've got two numbers in my head. One is 1200 milligrams and the other is 900 milligrams. And I can't remember which one is right. But one of those doses is correct for St. John's wort. I don't really care what brand you use. There's even a St. John's wort 1 a day, and that does have the therapeutic dose of St. John's wort. So if you look at that brand, then you'll know what the therapeutic dose is. I think it's 900 milligrams a day for St. John's wort.
Yeah.
And the trialing dose?
So yeah, that's the dose you'll trial.
And doesn't
and
it
then
take a little,
But you can split it up throughout the day. You know, it's going to help quickly, but then it's also going to be cumulative. Okay, you're not going to get the full effect of the St. John's wort with the first dose, but you
No.
should feel something. And you don't just keep raising it, you know, like you can do 300 milligrams 3 times a day.
And what are the
Now,
downsides? Any side of?
The downsides for St. John's wort is photosensitivity. So if you're using a really high dose consistently, people are going to have problems being out in the sun a lot. So this is the time of year that you get to start with it because people are less out in the sun. So people are going to have more problems with it by summer. But Karen, if you're doing all this testing and stuff by summer, you may be able to bring in the 5-HTP and you won't need the St. John's wort. So it should be more of a temporary thing. I always prefer using a precursor to rebuild neurotransmitter systems than tweaking it. St. John's wort is a tweaker, but in this case, you know, we may need to start there. Yes, Elena.
So, 2 things, like, what do you think about if they're gonna try the liquid forms, like the Gaia, the really good herb companies?
theoretically, the liquid forms are more quickly available. But I mean, I've used the capsules forever.
Okay. And also one other thing, and I'm not saying it won't work for your client, but it's there, like one of my former coworkers, I mean, she just swore by that St. John's wort. And when I have tried St. John's wort, and a couple of times I've actually taken it by accident, like in an herbal formula, like without paying attention. So I know it's not just in my head. St. John's wort and I are not friends.
Right,
There
but
is
Elena,
something
that's
about
every,
it.
yeah, but that's anything. Okay, we can get
Yes,
into
I
a
know.
sympathetic
Yeah.
reaction to anything.
Sure,
So, you just don't know until you trial it.
right.
But then once you do, if you have an adverse reaction to it, then that's not for you.
Right.
Yeah.
How many milligrams of tyrosine and of the DLPA?
You start low and then you build.
Okay.
I used the St. John's wort. Actually, was it? I don't remember. Was it St. John's wort or Kava Kava? One of the two. I
Well,
think it was the
those are
Kava
very,
Kava.
those are very
Yes,
different.
they are.
work on
Okay,
different
never mind.
neurotransmitter systems.
Yeah, never mind. Never mind.
Okay, Kava works on GABA. And
Yes.
St. John's wort works on serotonin.
Okay. Thank you.
And St. John's wort, by the way, is a prescription drug in England
Right.
and Germany.
Yeah.
It's that effective. When I was in my herbal medicine class many years ago, we wildcrafted St. John's wort. We went out and found it and picked it and pickled those yellow flowers. Jeff, do you have a question or comment?
No.
Okay. By the way, we just have, we've got half an hour, unless we want to stop early. Jeff, can you give us a very short synopsis of your new course, please, so that everybody knows about it? Because I want everybody to know about it.
Sure, I will do that. So this course started a week ago, this past Wednesday. It is addiction recovery engagement training, ARET. So it's like ARET course. And it's essentially for it's for family members, but family members in 3 different stages with their loved one's addiction or recovery. And the first would be a family member who's still using. The second group would be a family member in early recovery and then latter recovery, but the problems in the family haven't gone away. So those 3 stages are what this training is for. It is going incredibly well, fun, exciting. It's a combination of Phil Harris, who wrote the book, The Concerned Other, of his course, which is like 20 years old, evidence-based, has all the, research and all that data. And all of Mark's tools, or some of Mark's tools and some of my tools. So I'm just having a huge amount of fun.
I'm so happy for you, Jeff.
Yeah, thanks. And it's I'm still talking to one person who may be joining it still at this stage. The recordings, the ARET trainings are going to be recorded. So essentially there is 6 groups a week with this training. So it's like a lot of information, a lot of processing. for people at a lot of different stages. So that's kind of the, and if anyone has questions, feel free to reach out to me. And
Where
Elaine-
would we reach you, Jeff? Can you
Okay,
put your, is it too, and is there a fee for this? And is it too late to start?
so yeah, that's a really good question. So the training itself will, which is recorded, will at some point be an evergreen product that will be free. But
Will be free?
the training recorded, I think, will be free. And you know,
That's nice of you guys.
there's a lot of different groups that are kind of upsells from there. Actually, there's a Sharing Heart group every Monday night at 6 p.m. Mountain, and that's free as well. And so Sharing Heart, it's the emotions. Tuesday at 11 Mountain Time is the Curious Head group, which is more or less question and answers for everything in the training. And then there is the Full Tilt Addiction Smashers group, which meets twice a week. And that is like a lot of tools from the standpoint of laser coaching. So anytime someone has a question about something happens with their loved one and they're thinking, should I do this or should I do that? They can text me. I can get back to them ASAP, 10 or 20 minutes of coaching to help them decide for themselves, is it better for me to go this way or that way, kind of thing. So that's I think, really helpful service, because this isn't therapy, this is coaching. And when people have a situation and need help, that's the time to try to connect with them. And there's also two individual sessions a month, or 1 to family sessions a month, etc. There's like, we're really trying to set this up to support families to make change that affect their loved one, whether that change is creating conditions that are inhospitable to active addiction, or whether that change is encouraging their loved one over time with numerous conversations to stop using. So there's a lot of different aspects to this, and everything needs to be customized to an individual situation. So the fact that we have this training eventually, and I say eventually because it's like whenever Mark can do this, it will be in an app. So, and like when that happens, I have no idea. That's totally on Mark. He's the tech guy, and he's brilliant.
Well,
with
let's
that.
put it this way. We met with the app guy day before yesterday, and we have a date in the calendar to start the process of creating the app.
Okay. Wow. Well, you know more about that than I do.
I'm in the part of the process. Yeah.
Yeah. Great. Well, I'm so excited with the collaboration that you and Mark are doing. And actually, there's a number of times I see this as a compliment, or a, kind of like a very workable process and an upgrade from our system of care. So I see this as kind of a global thing, but that's my own grandiose thinking that I manage. And I'm sure you have your own thoughts about it, Christina, because it's awesome collaboration that I'm seeing.
And then is this like a course that's got a fee to it, Jeff?
Yes. So the fee is for this 5-week training, 6-week program is $497 for this 6 groups a week, all this information. And the fact that it's recorded is so beautiful in that when they are ready to engage and the situation does present itself, that then they can go back to that recording and look at it. So it's like there's a lot of different opportunities for people to start changing. And when families change, individuals can change. And for families that are all around the country, the other nice thing about this is that when people are ready for more information, they can go in and like one family member can say, hey, you need to really look at lesson number 5. 30 minutes into it, they talk about the situation we're in right now, kind of thing. So huge amount of possibility. I'm excited. Thank you for giving me a little airtime there.
Jeff, why don't you connect with Kathy Mendez after this meeting? It looks like she wants more of the resources. She wants to get involved.
Okay.
Anybody else from the class want to share about your experience in Jeff's training?
I will.
Lena.
Yeah, I tell you, it's been what, a week and a half, Jeff, and the family members that are involved so far, and it's small, which is nice. Like there's one mom who I thought for sure, Jeff, like by the second meeting, it was like, she just was like, I don't know why I'm here. And I mean, seriously, she was so, I was like, "Oh, someone please give this poor woman some tyrosine and some this and some that," in my head. And I tell you, in a week and a half, in less than a week and a half, the first time this mom smiled into that camera, I damn near cried. Like, I'm not kidding. It is so powerful, just so damn powerful. I just can't say enough good things about it. And Jeff and Mark are just so like compassionate, you know, and like I was reading somewhere, you know, like the true impetus of compassion is to observe and not absorb, which I always have to watch out for. Like, I feel everybody's pain and I want to save everybody, which is not a good thing. I can't say enough good things about it. And Mark's tech stuff, like, it literally is like an actual blueprint for like building a house. Like, literally. And if you look at a blueprint and you're not an architect, you go, oh crap. But then when you dig in with the help, like literally, like, where's my Kleenex? Like, I just want to like cry with joy. It's so beautiful. Anyways, I'll shut up now. Okay.
Wow, thank you for your feedback, Elena. And I think Kathy, you are in this training. I haven't spoken with you individually, but Mark has said some things that, so I am happy to talk with you individually whenever you would like.
Yes, I was able to join the first meeting, but then somehow I didn't receive the second emails. And I was in the middle of moving and closing on our house, so I missed the second one.
Okay, I just put my email address in the chat there. And so I do know that Mark, he has many things going on in his life. And when I was hearing Elena talk about this blueprint, I think you're talking about the one-pager thing that he's kind of putting, and that's not even the blueprint in Mark's recovery blueprint kind of.
I know. Yeah.
But
I have the big one. In fact, yeah, I know.
The one pager, the idea here is that as we go through this training with this one pager, and you know, everyone having a one pager after every training, and them actually filling out some of the notes and exercises and all that, some of the suggested stuff, that at the end of this training, they are going to have a lot of very specific criteria for them individually and their family to actually create change on a family level. So,
Wow.
yeah, it's exciting. And, you know, Kathy, I put my email address in the chat, and feel free to reach out to me. I'd be happy to talk with you. And Mark did mention that you were moving, and he was thinking that that was the reason why you weren't at the last training part of this. And Sunday at 3 p.m. Mountain Time is ERIT training number 4. And then at 5 o'clock Mountain Time is the Full Tilt Addiction Smasher group on Sunday.
But Jeff, everybody can attend your Monday night group, right?
Yep. Anybody. It's
It's sort of like their own take on Al-Anon.
yeah.
So that's open to the
Only much
community.
better. Sorry. Yeah. In my opinion, yeah.
So, yeah, it's very exciting, and it's really exciting to be able to put together this course under the umbrella of this collaboration with the Academy and Recovery Blueprints. It's, yeah, it makes my head spin sometimes, and it makes it difficult to sleep sometimes. So
I'm very impressed with what you guys are creating, and I just wanted everybody to know about it. So thank you. Thank you all for sharing. All right. Anything else before we stop for the day?
This has been a great morning. Lots of good information. Thank you so much.
You're so welcome.
Thank
All
you,
right.
everyone. This was incredibly helpful and so educational for me.
thanks,
All right.
Christine.
Yeah,
You're
me
welcome.
too.
Great class. Thank you.
Yeah, thank you.
Me
Yeah.
too.
Thanks, Christina.
Very welcome. Glad everybody was here. You guys are wonderful.
I'm
All right.
so grateful to you for having this group. It's just wonderful.
All right. I will see you all in a month.
Okay, enjoy your weekend.
You too.
Take care.
Thank you.
Bye.
Bye.